Imagine waking before sunrise with a fever so intense that the cave walls seem to move. Your throat is burning, every joint hurts. You cannot hunt, you cannot gather food, and you have no idea that invisible organisms are attacking your body. There is no thermometer, no pharmacy, no hospital, no doctor, and the nearest antibiotic will not exist for tens of thousands of years. So, what happens to you? The easy answer is that ancient people simply suffered and died. But the evidence they left behind tells a much more surprising story. To understand it, we first have to admit how little survives. A fever leaves no scratch on a skeleton. A cough does not fossilize. Bandages made from bark, moss, leaves, or animal skin usually disappear. So do most medicines prepared from plants. Bones preserve only a narrow record. Serious injuries, long illnesses, damaged teeth, and the traces of healing. That means prehistoric medicine is like a book with nearly every page missing. And yet, the pages that remain are extraordinary. At Dmanisi, in what is now Georgia, researchers found the remains of an early human who lived about 1.8 million years ago. This individual had lost almost all of their teeth years before death. For a person living without blenders, soup cans, or dental care, that should have been devastating. Chewing tough meat and fibrous plants would have been extremely difficult. Somehow, this person continued to survive. We cannot know exactly how. Perhaps the group shared softer food. Perhaps food was cut, crushed, or cooked until it could be eaten. The bones cannot tell us who helped or how often, but they do tell us something important. Long before cities, farming, or written language, a severely impaired person was not automatically left behind. Much later, around 45,000 to 35,000 years ago, a Neanderthal now called Shanidar I lived in the mountains of what is now Iraq. His body had endured terrible damage. A crushing blow had damaged the left side of his face and probably blinded one eye. His right arm had withered, and injuries may have made one leg difficult to use. Yet those injuries healed, and he lived to roughly 35 to 45 years old, an advanced age for his time. He could not have hunted or moved like a healthy adult. Researchers cannot reconstruct every day of his life, but his long survival strongly suggests that other people helped him. They may have brought food, kept him warm, protected him while the group moved or rested. Small acts repeated for years. That may have been the first and most dependable form of medicine, another human being. Care alone, however, was not their only tool. Ancient people lived inside an enormous natural pharmacy, even if they did not understand chemistry. Every plant could be tested. Some soothed pain, some reduced swelling, some caused vomiting, some were poisonous. Knowledge would have grown through observation, accident, memory, and generations of trial and error. But proving deliberate treatment is difficult. Finding a medicinal plant near a skeleton does not prove it was used as medicine. A person might have eaten it as food, used it for flavor, or encountered it by chance. One of the most intriguing clues comes from Neanderthal dental calculus, the hardened plaque still attached to ancient teeth. In a Neanderthal from El Cidron cave in Spain, researchers found evidence connected with poplar and a penicillium mole. The individual also had a painful dental abscess. Poplar contains salicylic acid, the chemical family that inspired aspirin. Penicillium is the genus that later gave us penicillin. But this was not a prehistoric aspirin tablet, and it was not an ancient antibiotic prescription. We cannot prove why those substances entered the mouth or whether they helped. The safest conclusion is simply that Neanderthals interacted with plants and fungi that had medicinal properties, and they may have recognized some of their effects. Their treatments were probably unreliable. The same plant changes with the season, the soil, and the dose. A remedy that eased pain one day could poison someone the next. There was no way to separate a true cure from coincidence. Still, when pain returned, people would remember what seemed to work. And sometimes they went far beyond plants. In a cave on the island of Borneo, archaeologists discovered the skeleton of a young person buried about 31,000 years ago. The lower third of the left leg was missing. At first, that might sound like the result of an accident or an animal attack, but the ends of the tibia and fibula had been cut cleanly, and the bone had remodeled as it healed. Researchers concluded that the leg had been deliberately amputated, probably during childhood. The patient survived for another 6 to 9 years. Think about what that means. Someone had to cut through skin, muscle, blood vessels, nerves, and bone without modern steel, anesthesia, or a sterile operating room. Fatal bleeding had to be controlled. The wound had to be protected in a tropical environment where infection could spread quickly. Then came the long recovery. The patient needed food, water, warmth, cleaning, protection, and help moving through steep rainforest terrain. We do not know the exact tools, the pain relief, or the treatment used on the wound. We should not pretend that we do. But the survival is written into the healed bone. This was not luck lasting a single afternoon. It was knowledge combined with sustained care. Other prehistoric skulls preserve another unsettling procedure: trepanation, the deliberate opening of the skull. In several cases, new bone formed around the opening, showing that the patient survived. The reasons varied and are often unknown. Some operations may have treated head injuries or pressure, others may have had ritual meanings. But whatever the purpose, a person was willing to place a sharp stone against a living skull, and someone else was willing to endure it. None of this made the ancient world safe. Many infections were fatal. A small cut could become deadly. Childbirth, broken bones, parasites, spoiled food, and infected teeth killed people who would recover easily today. There were no germ theory, vaccines, antibiotics, or reliable doses. Pain was common, and medicine often failed. But ancient humans were not helpless. When someone became sick, the first response was probably practical: stop, rest, drink, stay warm, and eat if food was available. A group might clean a wound, splint an injured limb, chew or prepare a familiar plant, and watch for changes. Skilled individuals may have remembered which remedies helped, which plants harmed, and how to treat injuries they had seen before. Their medicine was not a separate building or profession, it was woven into the group. And that may be the real answer to what happened when ancient humans got sick. They used whatever knowledge nature and experience had given them. Sometimes they attempted procedures more sophisticated than we once imagined. Often, all they could offer was water, warmth, food, protection, and time. But those simple things could keep a person alive long enough for the body to heal. The oldest medicine may not have been a herb, a blade, or a secret cure. It may have been the moment one person looked at another who could no longer keep up and decided, "We are not leaving you behind." If this changed how you picture ancient humans, Subscribe to Thoughtspur.